Hello everyone, I am Dr. Sanjanavb from siahmsr. Today let's discuss a very relevant topic, that is healthy aging. You might be familiar with anti-aging products, anti-aging foods, anti-aging skincare routine, but healthy aging is the right terminology we can use. Anti-aging is a misnomer where we cannot prevent aging completely. We can only delay aging to some extent, and we can control premature aging. We can address certain factors which leads to aging. However, our genes, our genetic factors operate in the aging process to a great degree. So healthy aging is the right term for addressing the age related changes. So what is the significance of healthy aging? Healthy aging concept incorporates both prevention of skin related aging factors as well as the entire body, the organs and other body system aging factors. Almost common, all these factors are almost common. However, it incorporates the concept of the whole concept or holistic concept. The total body and mind is involved in aging. So we should address the factors generally, not just addressing the factors which cause skin aging. Okay, so let's have an analysis or evaluation on the risk factors. The first important factor is gene, as I told you earlier, and it is the intrinsic factor which causes aging, and that is unfortunately non-modifiable. And we can focus on the extrinsic factors such as sun exposure and free radicals. Free radicals cause oxidative stress. Free radicals chiefly reactive oxygen species ROS and reactive nitrogen species. Both these free radicals cause detrimental effects on our skin and other body systems, organs. So free radicals are very deleterious to our health or very harmful to our health, because it can cause not only aging, it can cause severe or chronic diseases such as cancer, heart diseases, lung diseases, etc. So we should address these free radicals, and we should avoid things which leads to free radical attacks on our body. So we should avoid such foods. We should avoid such substances such as tobacco and some drugs and some chemicals, etc. Okay, and the third important factor is psychological stress. Psychological stress as well as physical stress. Physical stress usually happens when we go through an acute infection or some physiological conditions such as pregnancy and postpartum bleeding, etc. All these events are considered by our body as stress, and the body responds in such a way, and sometimes free radical mechanism operates in such conditions, especially we get an acute fever, viral infections, etc. For example, chikungunya viral infections, immune complexes are deposited, and dengue also causes severe stress on the body. All these kind of stresses can generate oxidative stress causing reactive oxygen species, and this can leads to aging as well as other diseases, other problems. As we see in chikungunya causing arthritis, immune complex deposition is the problem, and dengue also causes the person to lose his vitality and make him very weak, and generally the person suffered from hair loss. I have seen several patients with hair loss post dengue, and many acute viral infections including COVID can cause severe stress on body and skin. So we must address the weakening effect of these acute infections on our body. We can do that as a post-infection treatment, okay, post-viral fever treatment, post-COVID treatment, etc. Healthy, nutritious diet should be incorporated, and we should give instructions to the patient about starting exercise program after particular period of infection. Immediately beginning or starting exercise program is not wise. We should wait for at least 2 to 3 weeks in minor infections and more than 3 weeks in severe infections such as COVID. So all these factors should be taken into our mind, and it should be addressed in the proper way. Okay, then water intake. Water intake is very important. Water is very important for the elasticity of skin, for the moisturized, supple, glowing look of our skin. Not only that, water is very important for the metabolic process of our body, and many, that many vitamins are water soluble, and water is very important for our circulatory system and our metabolic system, etc. So take plenty of water, and at least 8 glasses of water at least. Water intake should be promoted. And another most important factor is addressing the oxidative stress. Addressing the oxidative stress caused by sun. We can use sunscreens, and we can cover the facial skin and the visible upper neck part, etc. But to some extent, at least for 15 minutes, we can have sun exposure on our limbs, so that we get some sunlight, and which can produce vitamin D. Vitamin D is very important for our bone health, and our diet alone may not be sufficient always. And the researchers states that, but sun exposure is an abundant source of vitamin D, and it generates vitamin D by acting on our skin cholesterol. Okay, so but we must take into account that it causes sun damage, sun induced skin damage, that is photoaging. So we must use sunscreens on our face when we go out and we get exposed to sunlight. Okay, and stress management is important. I already told you that physical stress can be managed by diet and other factors such as post infection exercise programs, mind body relaxation programs. Psychological stress can be addressed with the yoga and relaxation techniques, etc. And exercise, general exercise, I am talking about the routine exercise. Routine exercise, I always recommend moderate exercise, moderate intensity exercise, but ensure that it is not simple walking or simple running. It's much more than jogging. Okay, and swimming is a good exercise, but it is not a vigorous exercise. Okay, however, it has some effect on our body. Okay, and moderate intensity exercise in the long run. Sometimes strength training may be required. Some research studies states that strength training exercises are good for polycystic ovary, etc. But I recommend it only in the beginning stage if the patient is obese and patient wants to lose weight, and some insulin resistance has to be tackled. In such cases, we can recommend strength training or resistance training in the initial stages, but continuously I never recommend it, because it has detrimental effect on the skin, not only on the skin, and some free radicals are generated by that. So some researchers also do not promote it as a routine an exercise program, but in some cases it may be needed in some particular cases, not in all cases. But we have an important issue, oxidative stress to our organs, and it is related to aging, and it's related to diseases also. So how to address oxidative stress? That's an important question in healthy aging. And antioxidant foods are there. Antioxidant foods means vitamins, chiefly vitamin rich food. Vitamins means vitamin A, vitamin C, vitamin D and vitamin E are important antioxidants. Apart from these vitamins, many other substances are antioxidants, such as polyphenols. For not only polyphenols, some other substances, glutathione, etc. But all these antioxidants are available in our normal food. What we need is a focus on the diet. Focus on the food items we take daily. We should ensure that the diet we follow incorporates all these antioxidants as well as essential nutrients such as vitamins, minerals, proteins, water, etc. Fiber also. Okay, And for better health, fiber is important. Although it is not included in these antioxidant rich foods, fiber also is important, and it is rich in or abundant in fruits, vegetables, etc. So antioxidant foods chiefly are vitamin A. Vitamin A rich foods are green leafy vegetables, carrot, beetroot, etc. And it should be taken in moderate quantity. Excess intake of carrot is not recommended. Beetroot is not recommended, because hypervitaminosis A is also a problem, and normally it wouldn't cause, but vitamin A supplements in excess doses is not good for health. We can use beta carotenoid rich foods such as these carrots, and some other beta carotenoid rich foods such as tomatoes. All these are rich in vitamin A and beta carotenoids are effective antioxidants. So we can take these carrots, beetroot, green leafy vegetables for vitamin A as antioxidant. The same can be used for vitamin C also. Vitamin C is present in green leafy vegetables, and but it is abundant in citrus fruits. Citrus fruits such as orange, tangerines, and lime orange, and some guava, fruits like guava and gooseberry, etc. are great sources of, excellent sources of vitamin C. Vitamin C is an important antioxidant. It is not stored in the body, so we can take vitamin C in moderate quantities through natural fruits. And we can take vitamin D, which is also a good antioxidant. Vitamin D is rich in fruit, fish, dairy products, milk and dairy products, and oysters, etc., fish, etc., fish meat also, and it is present in cod liver oil. Then we can get vitamin D from sunlight also, and in some cases vitamin D supplementation may be needed, especially in people who resides indoors most often, and also those who reside in winter prevalent areas, geographical regions with winters and rainy seasons also. Rainy seasons such as areas such as the eastern states of India, and some regions such as Amazon forest areas. In all these regions, winters and rainy seasons cause deficiency of vitamin D, because people don't get sunlight. Okay, that's an important problem, and vitamin D supplementation may be needed in these areas. And vitamin E, when we speak about skin health and healthy aging, vitamin E is an important component, and vitamin E is discussed everywhere in skincare products, hair care products, etc. And it is always a buzzword for anti-aging. It is called as anti-aging vitamin sometimes. And vitamin E is abundant in avocado, almonds, and seeds, nuts, etc. We can include all these foods regularly in our diet. Avocado is a rich source of monounsaturated fatty acids and polyunsaturated fatty acids also, and we can use all these vitamins as antioxidant from natural sources. Okay, and we should include protein also for better skin health and healthy aging of the entire body. We should include legumes such as peas and peanuts, then grams, Bengal grams, green grams, etc. in our food. We can use kidney beans also, and we should use some oils which are anti-inflammatory substances in our food, such as olive oil and sunflower oil, etc., which are especially olive oil has for cooking. Olive oil has some anti-inflammatory properties which helps in reducing heart related problems, and improves cardiovascular health, and generally reduces obesity. It's an important component of Mediterranean diet, a diet followed in Mediterranean area, especially in the Greek, Rome, Italy, those areas. But now Mediterranean diet is an important diet pattern for reducing obesity all over the world. Globally accepted diet is the Mediterranean diet. Okay, so olive oil is an important component of Mediterranean diet. So we can use olive oil because of these properties as well as its anti-inflammatory properties. Okay, it's good for skin. We can use it as an external applicant also, but I don't recommend it in oily skin which is prone to acne, comedones, etc. Okay, we can use normal skin and dry skin. Olive oil and jojoba oil also good for skin health, but people with skin issues, allergy, etc. should not use all these oils, and they should take advice from a healthcare provider. And next is incorporation of non-veg food in our diet. Use fish. Fish is good for your healthy aging, and it's rich in omega-3 fatty acids, and which are good for your heart health, brain health, etc. Some seeds also are good for or rich in omega-3 fatty acids and good for better cognition, mental abilities, etc. And you use meat, but as far as possible avoid red meat. Red meat is not good for health, and healthy aging diets do not recommend red meat. And when we talk about meat, organic fat meat is preferable, and we can use water, plenty of water. We can incorporate or include plenty of water in our diet plan. And next is egg. Egg is an important nutritious food which can incorporate in our diet. Okay, and some mineral salts also are important for our healthy aging, such as calcium, iron, phosphorus, magnesium, and potassium, copper, etc. All these minerals are present in non-veg and veg foods, green leafy vegetables and egg, and all these food already mentioned incorporates these minerals also. So these antioxidant foods are important for preventing and addressing oxidative stress which leads to aging. So that is the essence of healthy aging concept or healthy aging program. So that's all about healthy aging. Thank you. Keep on watching SIHMSR, and type your feedbacks or your comments in the comment box, and your doubts also. Okay, that's all about healthy aging. Thank you.